Welcome to Counterpoint. I'm Tanya Granick-Allen. Are you miserable? Seems like an odd question to ask, but given that we just went through a very challenging time with COVID, did you find your misery grew during that period? From never knowing when the next lockdown was to occur, to many parents coping with children whose routines were upended, I think it would be an interesting exercise to examine misery during COVID. Well, good news. The Macdonald Laurier Institute has done just that. Not only have they compared Canada's misery levels to that of other nations, they have also compared interprovincial levels to see which province was miserable most. It's a fascinating study. And joining me now to unpack it all is Aaron Wudrick, Domestic Policy Director at Macdonald Laurier Institute. Thanks for coming on, Aaron. This is a very interesting topic. I didn't know that one should or could measure misery, but you guys seem to have done it. So, we've seen so many metrics during COVID: economic impacts, mental health impacts, morbidity, of course, case numbers, things like this. Why misery? What prompted such a study?
Yeah, the whole purpose of developing this index was because, of course, there were some extreme measures taken during COVID, things that we've never seen around the world, very extreme measures that governments were using, in order to combat COVID. And we thought that no one was really trying to weigh the trade-offs involved. Of course, COVID is a disease and it kills people, but there are trade-offs involved with the measures taken to fight it. So there are economic trade-offs, and there are also sort of quality of life trade-offs in terms of restricting people from doing things that give their lives meaning and give their lives enjoyment. So our misery index was an attempt to try and balance those three things, recognizing that there's misery caused by the disease itself, there's misery caused by the measures to fight it, and there's also economic misery imposed by some of the measures to fight it. So we just wanted to sort of build all three of those things into a single index and sort of see how countries stacked up against each other.
Yes, and we still seem to be suffering through, well, I guess in all three regards. Some people, are going through long COVID. We have some people, much of the world is suffering through the economic fallout from COVID and all of that. So how did you conduct this study? Because as a laywoman, when I hear there's a misery index study, I said, well, how does one actually measure that?
Yeah, and so we measure different metrics. So, for example, we measure things like excess deaths. For things like restrictions, we'd measure the length of certain lockdowns. For economic measures, we'd measure changes in unemployment. So there are hard statistical measures that we selected for each of these three baskets of things, which were, like I said, economic, response, and disease. And then we sort of compiled them and see. So some places, for example, did worse in terms of disease outcomes, and others did more economic damage. So, we just kind of wanted to, weigh these things in a consistent way against each other and see which countries fared better overall.
So, why don't we start with Canada? Because obviously we're Canadian and we want to know, how did we fare? Were we the most miserable nation in the world?
No, we're sort of middle of the pack, as it turns out. There were some countries that did a lot better. Again, we can debate why this was in terms of, for example, disease outcomes. And places which didn't have a lot of COVID, by extension, didn't have to impose as many restrictions at certain times. And so, they were also lower on other measures. What was very notable for Canada is that we seem to impose a much heavier response in economic misery for not much better outcomes. So in other words, there were places that had similar levels of disease misery, so similar number of deaths and hospitalizations, without imposing as heavy restrictions as we did. So the way to look at that, so from our point of view, is, well, if the purpose of having those restrictions was to improve your disease misery, you didn't really achieve that. You really just imposed additional misery in other ways without improving the disease outcome.
Now, your organization, Macdonald Laurier Institute, for which, again, you are domestic policy director, you updated these statistics or this study routinely throughout COVID. And, did the federal government not see what you were doing and say, perhaps we should recalibrate some of our policy responses here, given maybe some of this heavy-handedness?
You would think, but I think, certainly at the stage, especially the early stages when we were engaging this, we haven't updated it in about a year now. But when we left it, a lot of governments are still very seized by what I would call a very blanket mantra of play better safe than sorry, where safe meant shutting things down, closing things, banning things, and that the safety in question was COVID itself. The whole point of us constructing this index was to suggest, there are trade-offs. You might be making people safer from COVID. It's not even clear that happened. As I said, we didn't get much better outcomes. But there are other harms that happen. There are harms that happen, for example, in the education system.
Okay, I'm going to pause you there. Yeah. We got to cut to commercial. We'll discuss the harms in just a moment.